Colleagues, it seems like we all got together and I think we can start. Allow me to welcome you at our international virtual symposium. We understand that current situation requires for looking for new points, and I think it provides a good format and allows us to get together and discuss a very important subject, and that is impact of COVID pandemic and HIV on achieving sustainable development goals. And this event is held in support of organizing an international forum reaching sustainable development goals and combating epidemics. And we were planning to hold this forum in April this year. However, due to epidemiologic situation, we had to reschedule it. But as for today's virtual forum, it is held together with our long-standing friends, that is UNAIDS and WHO. And allow me to introduce Ms. Winnie Byanyima and UNAIDS Executive Director. We're very happy to welcome you, as well as Dr. Henri Kluge, who is WHO Regional Director for Europe. We are very thankful that you had found time to join us. Today we have over 600 viewers from more than 30 countries worldwide. We also have here representatives of medical facilities, business community. It is a live broadcasting that you can watch through net social networks. And of course, pandemic had a very adverse effect on healthcare systems worldwide. And of course, it can prevent us from reaching sustainable development goals and combating epidemics. And of course, well-being and health is of utmost important for us when it comes to the scale of pandemic. It is large worldwide, and as of today, more than 16 million people have been infected. Around 700,000 patients died, 10 million were cured. Despite the fact that the situation in Europe is improving, worldwide it is not getting better. Around 200,000 new cases are registered worldwide, and it is almost close to 300,000. 75% of all new cases fall on 10 countries, namely on Americas and Asian countries. Due to survey held by WHO, half of the countries, due to pandemic, had to limit the medical services, and planned vaccination was one of the aspects that really suffered. 175 million children in 75 countries will miss vaccination of measles, what can spur the outbreak of pandemic. As we also see quite serious situation regarding tuberculosis and malaria, and we also could see a large decrease in the number of children who received vaccination of tetanus and other diseases. And the overall immunization coverage may decrease as well. Per WHO, coronavirus pandemic may not provide comprehensive immunization for newborn children. 73 countries warned about the risk of lack of antiretrovirus medicines. 23 countries reported about the decrease in stock of these medicines. And that also may have an adverse effect on increasing the number of vertical transmission of HIV from mother to child. And under such conditions, in new reality, we have to take actions. And the goal of our symposium is to assess the risks related to coronavirus pandemic. We need to understand what we need to do today to combat pandemic successfully and prevent the outbreaks of other infections in order not to lose momentum. And we also need to see what we can do to use best practice cases in the best way. Today, the symposium consists of 3 sessions. First, we will hear the reports from key speakers, then we will have a discussion, and finally, there will be a Q&A session, and we will be able to touch upon the most pressing issues, and we will be able to make conclusions. And if there are no other recommendations, we can move on to the first session, and that is impact of COVID pandemic on reaching sustainable development goals in combating epidemics. And I will start if you don't mind. Thank you very much. Well, I would like to start with the following. I'd like to start with my presentation. I hope that you can see it on the screen. So next slide, please. As of today, we know that pandemic of coronavirus infection is going on and it is expanding. I have already referred to statistics that is quite worrisome for us all. And stabilizing situation in the Europe region still so far does not allow us to feel optimistic. Here you can see the dynamics of incremental growth per regions, and unfortunately, so far it does not look any good. As of today, we have identified 3 types of national response to pandemic. That is a passive approach that is characterized with insufficient and fragmented response. We are talking about some measures that prevent import of the infection. However, these measures are not taken on a regular basis, and laboratory screening is not done routinely as well. And many cases of COVID infection are not identified. Then there is a belated approach that is characterized with step-by-step introduction of measures as the situation exacerbates. But due to the fact that the situation can change very quickly, this type of response may be belated. And for instance, the limitation of free transportation initially looked at as quite extreme, although this measure could have prevented spread of infection tremendously. The third type is an advanced approach that is characterized with advanced introduction of measures that allow to delay the onset of the next stage of pandemic. And this is what happened in Russia. And we believe that the situation that we currently have in Russia is the result of our timely measures. And we understand this is an infection with characteristics that are not well known. Therefore, it is very difficult to forecast the good and efficient measures. And today it's very important to take lessons learned and analyze the received experience. Of course, pandemic presents lots of challenges, but lots of opportunities as well in terms of reaching the sustainable development goals. And if we are able to reach these goals, we'll be able to provide for well-being of people worldwide. And we understand that crisis of pandemic turned into economic crisis, and now we understand the scale of its impact. Pandemic impacts reaching of all goals, in particularly on reaching goals 1, 2, and 6, namely that is eradication of poverty, eradication of hunger, goal 3, good health and well-being, clean water and sanitation, that is goal 6, and goal 17, that is partnership in the interest of sustainable development. Current pandemic threatens an ability to reach sustainable development growth. And when it comes to healthcare, 50 countries worldwide had to limit the scope of medical services they provide. One of the most affected areas was planned vaccination, and unfortunately, more than 70 countries were not able to provide adequate antiretroviral therapy. And due to current pandemic, there is a higher risk for newborn babies to receive comprehensive vaccination, and 73 countries of WHO also warned about a risk of deficit of antiretrovirus viral medicines. 23 countries said that they have decreased in stock of these medicines, and certainly that will have an adverse effect on combating and containing HIV epidemic. As for Russia, on the 31st of December 2019, we already took first measures. First case of infection was identified in Moscow on the 13th of March 2020, and as of today, we have over 818,000 cases in 85 regions of our country, and the number of deaths is 13,354. The peak of incidence fell on 11th of May 2020, 11,000 cases altogether. But I should say that even during the peak of pandemic, and we are looking at the incidence per 100,000 people, still the incidence was far lower compared to what we could see in Europe and in the United States. I also would like to highlight the fact that response to the COVID pandemic demonstrated the fact that in Russia we had a high level of efficiency thanks to advanced approach we exercise. And we also exercised a systematic approach and introduction of limiting measures based on active screening and analysis. From day one of receiving information about this hazardous infection, we started taking active measures, and based on data received, we organized epidemiologic response that allowed us to contain spread of infection and get ready for the peak times. We also were able to produce required number of tests. As a result, on the 29th of January, we established a coordinating body, approved the national plan to combat pandemic, and on the 14th of May, coordination body at the government of the Russian Federation was established. We also increase the sanitary control along the borders of the Russian Federation, and we have examined over 6 million people entering country, and a large number of suspected cases were identified. We also established 480 observation facilities, and all individuals with signs of infection that arrived from other countries were isolated, and they were given additional tests to confirm the infection. As of today, we have carried more than 27 million laboratory tests. We're talking about PCR tests. We continue monitoring the inspection, and we do not decrease the pace of examination, PCR testing. We have a monitoring program aimed at identifying presence of virus in the population, and we test all the people that we suspect, even if they don't have signs of infection, in order for us to understand what is going on with the virus and the level of infection. This work is done in all the regions of the Russian Federation. We also are observing etiology of pneumonias, and we are giving coronavirus tests to all patients with pneumonia, and that also gave a very positive effect. And we continue observing patients with pneumonia even if they're not hospitalized. And all in all, we issued over 400 legal information documents and recommendations. They're all of public avail and available to the neighboring countries. Another important component to combat the infection is the introduction of diagnostic tools that thus were developed very quickly, and we developed the first diagnostic test in less than 1 week once we received information about the virus sequencing. Today, we use a total of 21 test systems, and for there is PCR test and antibody identification test. It is also important to develop vaccines against new coronavirus infection. At the moment, Russia is developing 26 versions of the vaccine, and 6 of the prototypes were developed by Vector Scientific State Facility, and we are going to test a new vaccine against COVID-19. And as of yesterday, we launched stage 1 and 2 of clinical trials for this vaccine. Vaccine is different from the similar ones. It is peptide. It does not have a biological agent. Therefore, it is supposed to be quite efficient. Taken into consideration the vast experience of the Russian Federation,
so, together with the governments of the Russian Federation, we started to provide help to our partners from abroad to fight against the coronavirus infection in line with the order of our president. And we supply highly efficient test systems without any payment. Over 800,000 tests were provided to different countries, and we provide methodological and technical aid, and we improve also the capacities of their laboratories, and also there is a huge contribution by our aid programs to fight against coronavirus. This is our long-term cooperation with our colleagues from different countries on different areas of work that you can see in the slide. Is a decrease of the risks of different diseases, and these are also promotion of sanitary requirements and fight against plague and also fight against force majeure situations, and it's also elimination of different diseases, and also elimination of HIV and AIDS. And also, we have a program to fight against missiles and also the program to fight against antibiotic resistance. One of our priorities and the most important component in our work in Central Asia and XCIS countries is the support to their sanitary and healthcare institutions and centers, because they are really fighting against COVID-19. No, and we provided 15 mobile labs. We provided our help to these institutional centers. We provide our vaccines and the lab equipment, and we provide training to the experts from all of these countries that we cooperate and interact with. And I would like to speak separately about our joint work on prevention and diagnosis of infectious diseases, including HIV and AIDS, that we started in 2013. This is the third phase or a third stage of the project. We have mobile clinics, and we have already accomplished over 1 million tests, 1 million people, and we created two training centers for migrants in Tajikistan, and also Republican Center of AIDS in Armenia, and we have five R&D programs uh, to start a resistance of HIV against treatment circulation of strains of HIV, and in the countries of Western, Eastern, Central Europe, Asia, sorry, and also we provide training programs. COVID pandemic emphasized once again the importance of international cooperation, and Russia initiated this cooperation within Eurasian Economic Union, CIS, and Shanghai Organization of Cooperation, and also the summit of Shanghai Organization of Cooperation. And Russian government initiated a plan to be approved for health care and sanitary well-being against the spread of COVID, and we developed the joint actions plan to fight against the infectious disease in our region, and we are finishing two main agreements, which is the center protection of CIS countries and response to force majeure situation related to epidemiological situation in this territory. And Russia is leading now the Shanghai Organization of Cooperation, and the main doctors, sanitary doctors of our organization. We aligned the joint plan to fight against the spread of COVID on our territories, and we'll have the summit in autumn this year. And Russia initiated announcement of the leaders of our region related to how to fight against the pandemic. In order to strengthen the resilience of centrological services of Eurasian countries, and we need to establish regular exchange of information. We need to develop algorithms to respond to the situations and to use the mobile uh, opportunities. We already have the Center for Monitoring and Response, and we process information there. And we are ready to strengthen our cooperation, and we are ready to do many joint programs. Together with Koch Institute in Russia, we plan international training for the Central Asian countries and Eastern Europe countries, and we had to postpone that for next year. So, the pandemic of COVID-19 impacted dramatically the progress on delivery of CDG goals, and we will still have to evaluate this negative impact. At the same time, together, we as scientific community and healthcare community, so we need to try to eliminate those negative impacts, especially in developing countries. So we need to find against the disease which can be cured by vaccines, and we need to enhance programs on so-called tropic disease and monitor the transborder spread of infections. And we need to prevent elimination of the progress in line with SDGs, and we need to set the new agenda for international cooperation. And international organizations, scientific communities, and states need to invest the additional efforts to fight against infectious disease. It's important to strengthen sanitary and epidemiological services of their countries, provide for a restoration of immunization program, enhance the measures to fight against tuberculosis, hepatitis, HIV, and AIDS, and develop the action plans to improve the readiness of their healthcare services. And international organizations, UNAIDS and WHO, need to assess the impact of a pandemic on the delivery of the third goal, so poliomyelitis, prevention of HIV, malaria, and tuberculosis, and develop the measures to fight against infectious disease and provide for methodological information support. From the scientific community, we need new researchers to evaluate the social economic impact of pandemic and its impact on the healthcare system. And also, they need to provide rationale for additional measures to uh, deliver the SDG 3. And we need to speak about the high demand for the needs of new researches. All of these areas of research should be discussed in detail at the International Forum of delivery of Sustainable Development Goals, which is supported by the government of the Russian Federation, Rospotrebnadzor, and a WHO UNAIDS program. Thank you for your patience and attention. I'm a bit ahead of the schedule behind, and so that's a very relevant topic. I could not miss even one word from our presentation. That's so important. I'm happy to welcome at our symposium the executive director of UNAIDS, uh, Mrs. Winnie Winnie Byanyima. She's the first woman to lead UNAIDS since the foundation of this organization back in 1996, and they continue their work in such complicated situation of pandemic, global pandemic. UNAIDS regularly publishes the recent scientific data on impact of pandemic on the health of people infected with HIV and AIDS. They are our long-term partners since 2012. With the support of the Russian government, UNAIDS is providing help to the countries of Central Asia and Eastern Europe to fight HIV/AIDS and other infections. This is the third stage of our joint program, which we try to show in the presentation. And within the aid to these countries, with the support of our government, there were supplies to 6 countries of 6 mobile clinics, and the numbers that you saw in the slides speak about efficient cooperation, which is quite fruitful. And I'm happy to give floor to Mrs. Vin Bianima. Please make your presentation. You are very welcome.
Thank you very much. Thank you, Dr. Anna Popova, my colleague, Dr. Hans Kluge from WHO, and distinguished ladies and gentlemen. Let me begin by thanking our colleagues in the Russian government for your strong leadership on COVID-19 and for your years of consistent engagement and support to UNAIDS. Dr. Popova, we haven't yet met face-to-face, but I've read about your leadership in the response to COVID in Russia, and I've been briefed about your many years of championing, leading on HIV/AIDS and supporting UNAIDS. So thank you. Hans Kluge, you too came on board as the regional director of WHO at a challenging time. You're delivering strong leadership across 53 countries, and you're working so closely with us at UNAIDS, so I thank you for your friendship and collaboration. Today, I'll speak about the lessons of HIV, which we can use to manage better the response to COVID. But I'll also speak about the risks that COVID places on the progress of HIV and other SDGs. I must first emphasize that the global HIV epidemic remains a global crisis. I'm concerned that the sense of urgency and the political commitment to end AIDS epidemic is waning. As you saw from our recent global report, the 2020 targets for this year are not going to be reached. Despite the progress that has been made in recent decades, even before COVID-19, we were not on track. The crisis of COVID risks blowing us much further off course. Our progress in the global AIDS response proved that actually dramatic, rapid progress is possible. But our outrage, our anger at the tragic impact of AIDS has been missing in recent years. Only 10 countries will reach the 1990 targets before the end of this year, and none of them are in Eastern Europe and Central Asia. It's really unacceptable that new HIV infections are persisting year after year in all regions of the world. And we are not giving this renewed attention, more resources, and more action. No health challenge over the last century has equaled COVID-19 in the speed of its spread. At this moment, the first order of business is to stop the spread of COVID and to mitigate its impacts. But it isn't the first epidemic we have faced. As regions, as countries, as communities continue to fight COVID, few have leveraged the experience and the investments from the HIV response. That's a concern. Let me share some lessons of the HIV response and what it means for the call of the Secretary General to build back better. HIV and now COVID have put massive stress on health and social support systems and have a direct impact on economic productivity. For the last 25 years, UNAIDS has addressed the challenge of the HIV pandemic, including in Russia, across Eastern Europe, and we've used a comprehensive multi-sectoral response based on data and support for affected communities and a commitment to protect human rights and fight discrimination. Let me go through some of these. First, the importance of more robust strategic information that delivers timely, accurate data on the pandemic. At UNAIDS, we have built the largest database ever assembled on a health issue, HIV. But it's not only surveillance and treatment data. Every year, member states share with us disaggregated data by sex, by age, by race and ethnicity, and other variables, as well as financial and legal data to guide more timely, focused responses. This is a kind of comprehensive data, disaggregated data that's needed for COVID-2 in order to get ahead of the epidemic, the pandemic, understand its long-term impacts on health and also its socioeconomic impact. Second, HIV response is through our HIV response, we have pioneered in building and sustaining critical political leadership. COVID cannot be effectively addressed without committed leadership at all levels. Leaders must have the trust of the public, and that must be consistent with accurate messaging, always listening to science and data, and ready to sustain that leadership over a long term. In recent months, we've seen strong leadership on COVID-19 in this region of Eastern Europe and Central Asia. But when we look at HIV, we see how challenging it is to sustain leadership over the long term. And I fear that COVID could also lose momentum on leadership. Third, it's important to use a multi-sectoral approach to address the social and structural drivers of health outcomes. From the outset, the HIV response leverages the efforts of diverse sectors. Of the 90 countries reporting data at UNAIDS in 2019, 78 reported having a national HIV strategy that was developed through a multi-sectoral process. Now, I wonder how many countries developed their national COVID response through a multi-sectoral process. Today, COVID is spreading in prisons, in migrant communities, in crowded neighborhoods. COVID-19 responses won't succeed if they don't address not just the health needs, public health needs, but also all the other human needs, including social protection, jobs, housing, food, migration issues, education, everything. Fourth, community engagement. Community engagement is critical to address any epidemic or public health threat. The leadership and engagement of communities has been critical to the progress of the HIV response. Most people who have COVID experience mild symptoms that are managed in the community. So COVID responses should place affected communities at the center of the response, fully involved in planning, implementing, and evaluating the response. Only by partnering and empowering communities can the responses reach far enough, have the impact we want, and reach everyone equally. These governments cannot do without the involvement of communities. Here in Eastern Europe and Central Asia, you have strong NGOs who have capacity and professionalism and who are ready to do more on HIV and on COVID. Use them. Governments and international organizations really must support them and empower them to lead in communities where they serve. We are very proud to see that HIV experts from science, from infectious disease sectors, from community organizations are at the forefront of responding to COVID. Service delivery systems created for HIV are serving as primary service sites for testing, diagnostics, treatment of people with COVID. That's great. One of the first stories we published at UNAIDS on COVID was a profile of how the staff at Russia's network of AIDS centers had mobilized in the COVID response. But having said that, we can't allow that precious HIV resources and expertise is diverted at the cost of progress on HIV. Russia, many countries connected today on this webinar, still have an ongoing HIV epidemic. So we can't allow COVID to set back progress when we have committed to end AIDS by 2030. We have to keep both balls in the air, fighting COVID, fighting HIV, both at the same time. Finally, COVID-19 crisis has highlighted the huge inequalities in the way the world develops, produces, and distributes health technologies like diagnostics, treatments, and a vaccine. These are essentially public goods. Granting one company exclusive rights to the science, the intellectual property of a coronavirus vaccine would prevent us from getting the billions of doses that the world needs. No private company should have a monopoly over this public resource. A global pandemic is not a time to artificially ration the supply of a medicine because of these ideas about the sanctity of intellectual property. We can't protect the market simply to serve the interests of pharmaceutical companies at the expense of the health of everyone. That's why UNAIDS convened key partners to support the call for a people's vaccine. And this was signed by more than 150 global leaders and experts, including sitting presidents. Our call is to prevent monopoly on vaccine production and supply, to implement fair allocation, prioritizing health workers all over the world, and prioritizing other risk groups in all countries, and to provide the vaccine free of charge at the point of use. That is the purpose. The Secretary General of the UN has endorsed this call and made securing a people's vaccine a UN system-wide objective. I encourage countries and partners in Eastern Europe and Central Asia to join this call. All countries and companies should contribute their knowledge and intellectual property to WHO's COVID-19 Technology Access Pool, CTAP, where technology and treatments are shared for the benefit of all. The WHO's attempt to organize a global system where diagnostics and treatments and preventive technologies are allocated equitably is really vital. We should make it succeed. It's through the people's vaccine, supporting the CTAP and maximizing supply, through strengthening safe manufacturing capacity in developing countries, that we will beat this vaccine nationalism that we are seeing, where some rich countries are grabbing future doses and leaving others without. In closing, let me conclude with a call to action to build back better. The two epidemics of HIV and COVID-19 don't allow us to do business as usual. We need to use every opportunity to ensure that we are moving ahead in a bold and an integrated way. We need to move with a sense of urgency on HIV than we have seen in recent years. We need to move fast in getting ahead of COVID-19. Because across Eastern Europe and Central Asia, and at the global level, we will be judged for what we do next. Thank you so much. I'm sorry I took long to.
Спасибо большое, госпожа Byanyima.
Thank you very much, Mrs. Winnie Byanyima. Dear colleagues, now I would like to give floor to our next speaker, Director of European Bureau of WHO, Dr. Hans Kluge. So he's the director for European Regional Bureau of WHO, and he became its head on February 1st of 2020 when the epidemic was already growing, and he needed to quickly make an update. We know that Dr. Kluge had previous experience in fighting against infections in the regions, in European regions, and today I would like to thank you, Dr. Kruger, for paying attention to our problems in our regions, for participating in the coordination committee on the infectious diseases committee, and with the support of WHO European Bureau. We established the evaluation commission in Tajikistan, evaluated the situation in this country, and we started some actions here. And today our experts, they continue to work in Tajikistan, and we are ready to provide all the necessary support to WHO. And so you have the floor, Dr. Kruger.
Anna Yurovna, госпожа
So, dear friends, dear Dr. Anna Popova, I would like to thank Anna Popova, our partner in the Russian Federation and Executive Director of UNAIDS, Winnie Byanyima, for organization of this virtual conference, Symposium. And as of today, in our region, we have over 3.2 million cases of infections and 210,000 deaths all from COVID-19. At present, so the eastern part is the most effective in our region, and now we are talking to those who lost their beloved ones and friends over the past 6 months. From the pandemic of COVID-19, we'll have many useful learnings, but one bad learning we already have. That's many healthcare systems were not ready to respond to such situation. Even the strongest healthcare systems were working and operating at the borderline of their opportunities and capacities, and we could not provide any support or aid medical care to people with HIV/AIDS and deficient immunological status. And talking about the future healthcare system, so they should be, like we say, WHO, at the additional pathway. We need to be ready to increase our potential capacity to fight against this disease, I mean COVID, and we need at the same time support the basic functions of healthcare system, provide the basic care. And this will require not only closer integration between the communities of the primary care and secondary care, outpatient and inpatient units, but we also need to have a joint political agenda among all of the countries. So this is the gist of SDGs, of the goals of sustainable development. And it opens for us new opportunities that we have now while we are fighting against COVID. COVID-19 is a threat on providing medical care to HIV infected people with HIV infections. Despite huge progress here, especially in Central Asia and Eastern European countries, the medical care is highly demanded, and it's not accessible to many people who are infected. Over the past decades in the European region, there was an increase by 22% of the new cases of HIV. And in 2018, the late stage infection was diagnosed in half of these patients, And the coverage with treatment with retroviral drugs is very low. And as for COVID-19, this is a threat to us. It can worsen the situation, but as of today, we are aware that as a consequence of COVID-19 in some countries of our regions, there were interruptions in supplies of antiretroviral drugs. And we still have to assess completely this destructive impact of COVID-19 on the total dynamics of pandemic of HIV/AIDS in our regions. The good news is that even with this pandemic, we can make serious learnings. The first learning is international cooperation and solidarity. This is an efficient response. And where we did not see this solidarity, there were no successful response actions. Nobody will feel himself safe until everyone is safe, and nobody should be left without attention. So this is the English version of that. And the second learning, so when we are selecting, so we cannot choose between making money or saving lives. And we have consistent policies and we develop the guidelines for the countries to support both economies and educational systems and the measures to respond against COVID. The third learning, healthcare systems were not ready against the pandemic, which was spread at such a rate. And we need strong healthcare systems which have as their foundation a very strong primary care systems with integrated functions of protection of health of the total population. And we need the mechanism to inform about the risks of the whole of the population. Everything that we need is to make life our declaration on primary medical care.
The healthcare systems need stable investments and mechanisms that will provide link with operations of sanitary services so we can cover all groups of population, especially the most vulnerable ones. This is even more relevant when we are talking about targeted aid to people living with HIV. Precisely speaking, our individual and collective response is connected to large opportunities, not only control and prevent COVID spread in the future, but that allows us to become stronger if we get rid of its consequences, and it will also can allow us to improve and enhance our healthcare systems. We have an unprecedented favorable opportunities because right now the goal of enhancing healthcare systems is of utmost importance for governments, and it is on top of political and financial agendas. We need to do our best to provide the most benefit for all stakeholders and for our people. Dear friends, we have all we need to enhance and redesign healthcare systems for the future. Healthcare systems should be built on fair basis, and it also should be oriented on people's, communities' interests, and should be linked to social agenda that will leave no one behind. To implement these structural changes, we need to make collective efforts. We need all European and global leadership that will be based on innovative approach, on courage and willingness to collaborate. I would like to thank Dr. Popova for huge support provided to Central Asian countries. Last week, I participated in a meeting of health ministers of Shanghai Organization for Cooperation, chaired by Minister of Health of the Russian Federation. And we discussed all problems related to COVID pandemic. And I was very inspired by the leadership of Shanghai Organization for Cooperation, the forum dedicated to goals of sustainable development and planned for November this year to be held in Russia. This forum will provide a good foundation for closer cooperation aimed at reaching sustainable development goals. And here we need to provide fair, equal access, high quality treatment of HIV and provide best services for people living with HIV. My vision is linked to forming culture of health and well-being, what will allow people in the regions to be in the focus of attention, and that will help us to create a good social care for each and every citizen. It also will enhance environmental sustainability. And again, what's important, no one again will be left behind. This is again in the focus of attention of Regional Office of WHO, United Action for Better Health. I would like to reassure you that by being a new director of Regional WHO, I will provide my contribution in using best practice in combating COVID pandemic and will extrapolate the best experience across our regional offices, and our organization should be dynamic and innovative, result-oriented, and we should do our best to better service the interests of our people. And we need to reach two goals. First of all, not to leave anyone behind, and also increase the leadership of healthcare facilities. But to achieve these goals, we need to act together. You can rely on me, and I can rely on you. I wish you to stay wealthy and healthy. All the best. Thank you very much, Dr. Kruger. Thank you very much for your fantastic Russian. Thanks, dear colleagues. We are finishing the first session, and if you don't mind, we are moving on to the discussion session of today's forum. And here we invited several speakers, and I hope they will be able to comment the presentations and speeches they have heard, and allow me to give the floor to the Deputy Health Minister of the Republic of Armenia, Lina Nanushan. Lina is our long-standing partner when it comes to combating HIV. She has always attended Moscow conferences. We are very pleased to have her here today, and we would like to hear her opinion regarding the impact of COVID-19 pandemic in fighting HIV. The floor is yours, Ms. Nanushan. Thank you very much, dear Anna, dear Ms. Byanyima, Dr. Kluge, dear participants. First of all, allow me to thank you for an opportunity to participate in this forum and being able to discuss such an important topic as impact of COVID-19 pandemic and HIV on SDG 3.3. The COVID pandemic has made tremendous changes to global health programs and Armenian health programs. We had to respond quickly and provide medical health to everyone so that no one is left behind. Before I tell you what the Republic of Armenia has done in order to provide adequate services to people living with HIV, allow me to talk about situation with the COVID pandemic. As of today, we are providing treatment to 9,000 people daily. We are registering 300 cases. The death rate is 1.9%. From epidemiologic standpoint, the situation is quite stable in the country, and given this situation that we've been experiencing since early this year, I would like to pay your attention to another epidemic that we've been fighting for 30 years, that is HIV epidemic. And those decisions that were made to improve the situation are providing good effect. And in the beginning of this year, when we restricted transportation of people in order to stop spread of invasion, it was also important to provide medicines to people with HIV. And here we experienced some challenges, but thanks to continuous cooperation between governmental bodies, NGO organizations, we were able to continue providing aid to patients with HIV and to all stakeholders. Namely, we made a number of steps to overcome all the challenges. First of all, we decided how we will provide the antiretroviral medicines on a continuous basis, and there was a permission given to transport medicines to and deliver medicines to patients with HIV, and within 1 month, we were able to provide medicines to 450 patients with HIV. And understanding the status of risk groups, we were able to provide updated information about COVID pandemic, and NGOs and beneficiaries were able to receive personal protection equipment and sanitizing tools. And centers for combating HIV and NGOs are helping to combat the epidemic. We provided consulting, and we were able to switch to online format and keep in touch in online manner, holding forums and sessions. We also used mobile centers provided by the Russian Federation together with UNAIDS, and these centers were able to continue testing for HIV and COVID. We also made measures to supply medicines, TB medicines to all patients within 1 week and further depending on the doctor's prescription. Antiretroviral medicines were provided for 1 or 2 months. Thanks to careful planning, we were able to avoid deficit of antiretroviral medicines, and we placed orders for the medicine in advance, and we have sufficient amount of medicines till the end of the year. Also, thanks to careful analysis of needs of patients with HIV, we were able to assess sufficiency of measures taken, and we also identified some gaps that we were able to close. We made a survey across the Republic, and we found out that during lockdown, patients with HIV had no problems in receiving medicines, and most of them were able to receive them personally, although many respondents wished they could get psychological help in managing depression and anxiety. Many underline the importance of being in touch with doctors and also a possibility to do a coronavirus test. And wrapping up, I would like to say that despite the report of UNAIDS issued in June this year, Armenia is a country that is ranked second in terms of 1990 indicators, although we were not able to reach the desired results. And if we are not active, if we do not actively engage in fighting AIDS now, we might see the situation exacerbating. And it may happen that during COVID pandemic, another epidemic may emerge. And I think in this regard, such symposiums are very important. We need to continue collaboration with our partners from Russia, UNAIDS, and WHO. I would like to thank you for your attention and stay well. Thank you, Lina Manukovna. Thank you for highlighting these important aspects. Dear colleagues, today's symposium is dedicated to measures need to be taken to reach sustainable development goals in combating epidemics. Our next speaker is the director of WHO Center in Moscow, Mr. Vladimir Kuznetsov, and we know that he does a lot in order to spread the most important, the most updated information across the Russian Federation. And today it is of utmost relevance. So, Vladimir, I would like to give you the floor so you will share with us your point of view and tell us about what you do. Thank you, Anna Yurevna. Thank you, dear Ms. Winnie Byanyima, dear Hans Kluge, dear friends. I'm very happy to welcome all participants of this symposium. The importance of holding today's symposium cannot be underestimated. The agency you had, Ms. Popova, is on the front line of combating pandemic, and you do a very good job in overcoming challenging situation. And the our colleagues from UNAIDS and from WHO, and also do a lot. And by participating in this symposium, they recognize the relevance of these efforts and of what has to be done in order to combat COVID pandemic as well as HIV pandemic. And it's very important to join our efforts, and especially when we face such a tragedy nowadays. And if we think of the topic of today's symposium, we can say that COVID affected not only our sustainable goals, but also highlighted all the gaps and weaknesses that were ignored by the humankind over decades. We have some gaps in social protection. We still have inequality. We have violation of human rights. We have exacerbating environmental situation. All these problems have to be addressed. And it is obvious that global international response to COVID pandemic can happen only if it is coordinated by WHO. And I believe that countries that take successive actions exercise this approach. WHO is a coordinating body that can indeed enhance the global public health. And of course, it does it best in order to address pandemic in the best possible way. And WHO is the leading mechanism to mobilize efforts of all countries to counteract infection, and that is what is going on today. Of course, spread of coronavirus infection made an adverse effect on attaining the Sustainable Development Goals, and the speed of response of these or other countries demonstrated how actively they were engaged in joint initiatives. Right now, it is a very challenging time that may change our lives dramatically, but we should not forget about the trajectory of global development that we chose 5 years ago when we identified 17 goals of sustainable development. And here, Russia has done a lot to counteract pandemics and COVID in particular. From day one, the Russian government did its best to come up with best measures to protect their population as well as the healthcare system. I already talked about the role of Russian surveillance agency. Russian healthcare system confirmed its resilience at the peak of pandemic, and now when we are able to cover all people in need and the system is ready to respond if the uh, pandemic will start increasing. By the way, I myself was treated against COVID, and I was impressed with the high level of medical service provided here in Moscow. And of course, COVID-19 and pandemic is a tragedy for the whole mankind. However, it gives us a chance to build a world with greater equality. Antonio Guterres, the General Secretary of UN, and lately he was given a speech dedicated to Nelson Mandela. So he said that the response to pandemic should be based on global agreements that will provide equal opportunities to everyone and will respect human rights. And this is the only option for us in order to reach sustainable development goals efficiently. And the agreements that we have should aim at eliminating gaps and disadvantages identified during pandemic. It is also important that the Russian Federation provided the national review on measures taken to achieve sustainable development goals. And that is very relevant to our today's discussion. This report was elaborated in close cooperation with the UN. Wrapping up, I would like to wish you stay healthy and thank you very much for your attention. Thank you very much, Vladimir Valerievich. And today we already said how important it is to engage communities when confronting pandemics, especially when there is a threat to large numbers of people. Ms. Byanyima was talking about the role of communities and looking back at what we experienced, and this is also something about what the Russian president was talking about. Um, so consolidation of population is very important, consolidation and solidarity. And in Russian Federation, one of the examples of such solidarity is the establishing of an organization called Medical Volunteers. Many social organizations have been very active providing assistance to people in need, to elderly, lonely people. And you know that all people over the age of 65 had to be locked down and they had no chance to go outside to do grocery shopping or to buy medicines. In order to help all people with medical or other needs, we had quite many volunteers ready to help. And our social organizations did so much to provide help to these people who were in need. And they were providing information, kept in touch with them over internet or by phone. They used all channels of communication to provide all kinds of help, including psychological help. Now I'd like to give the floor to Pavel Savchuk, chairman of All Russia Public Movement, medical volunteers. The floor is yours, and your message is very important for us today. Thank you. Good day to all of you, Ms. Popova, Ms. Byanyima, Dr. Kluge, dear colleagues. It is a pleasure for me to speak at this symposium and share our experience in combating coronavirus infection. And we pay attention to extrapolating programs aimed at combating cardiovascular diseases as well as infectious diseases such as HIV and others. And in this regard, we work very closely to UNAIDS, to WHO, and to Russian Surveillance Agency. Of course, coronavirus infection became a huge challenge for our country as well as for the entire world. And today I would like to tell you what Russian volunteers did to combat pandemic, and we worked in our country together with the Association of Volunteers. Next slide, please. In 3 days, we were able to organize headquarters in all Russian regions. Over the past months, we did a lot to provide targeted aid to people in need. We, first of all, are talking about senior citizens over the age of 65 years, people with limited mobility, large families and other citizens that were in need. And we can say that all in all, we received over 3.6 million requests. This and the help that was provided was targeted. We had a lot of humanitarian initiatives. Some received food for free, some received legal advice, and so on. We engaged almost 120,000 volunteers. We had over 90 partners that were willing to join us. And thanks to our joint work, we were able to raise 1.8 billion rubles that was used to support most vulnerable groups of the society. And we were tasked with many issues. First of all, we had to organize volunteer activities in a safe way. We had to prevent the spread of infection through volunteers movement, and we had to support medical professionals during pandemic, and we had to allocate financial and material and human resources in a careful and well-designed way. Talking about our key segments of activity, that is purchase and delivery of essential goods, and it was very important to decrease the necessity for people to leave their houses, especially it was relevant for senior citizens. So we were able to process hundreds and thousands of requests. There was a federal hotline that could be used by all the citizens who were in need, and all volunteers were protected in the best maximum way. They had personal protection tools, and we also provided the assistance to medical professionals who had to stay at hospital during the peak of infection. And of course, I would like to highlight providing psychological support. Over the 4 months, we were able to establish a community of psychologists who voluntarily could provide psychological support to those in need. We had great infrastructure, chatbot and Vibers, and anyone who needed psychological help could contact us. Talking about specifics of organizing volunteering activities, we had to again take preventive measures to limit the number of large events. We had to develop a format of online support and had to coordinate activities of volunteers, and we had a center for volunteer activities coordination called Medical Volunteers in the middle of March, and the heads, originally heads, would coordinate their local activities and report to the center. And it was also important to work in close connection with the regional headquarters in order to get updated information about the spread of infection and provide best support to volunteers. We had a special system for receiving requests for their processing. Therefore, we could respond to requests really quickly. Taking into account our experience, we were able to hold online meetings several times together with our colleagues from Kazakhstan, Uzbekistan, Kyrgyzstan, where we shared our experience, and we are very thankful for this collaboration. Again, talking about providing support to medical professionals and hospitals, we can again, we know that all medical professionals were on the forefront of fighting pandemic. It was very important to provide support to medical professionals, to their families, to deliver them food and also provide them free accommodation during the peak of pandemic. We purchased over 900,000 kits of personal protection, and we also developed training system for volunteers that included distance training program, face-to-face training, accreditation process, and so on. It was also important to take into account the logistics to make sure that volunteers don't have to travel long distances and could work as close to their houses as possible. There was an online map that could be used by any volunteer so that they could know where help needed most and get connected. As for safety, it was a priority for us at all stages of our activities.
добровольческой деятельности в период распространения коронавирусной инфекции, рекомендации по профилактике и распространению COVID для организаторов волонтерской деятельности, обеспечение волонтеров средствами индивидуальной защиты, более 5 миллионов наборов.
So about 5 million kits were procured, and we also ensured volunteers split of their work, and we also introduced the work schedule, 1 week of work, 1 week of self-isolation, so that we can prevent the cases of infectious spread among the volunteers. In the next slide, you can see the results of our work. We had the Victory Day. We had to also provide care to our veterans. Around 1.5 million people received the free gift packages of food. And we collected a huge experience of volunteering work during pandemic, and we are also thinking about strengthening and preserving our experience and launch more volunteer programs in our country. It will be especially relevant in post-epidemic times, which will happen soon. Thank you for your attention. Thank you, Oleg. So that was a very interesting presentation. So, Pavel, so sorry, I just, sorry, that's my mistake. And I would like to add that we were also talking about the responsibility of business, and also Dr. Kluge mentioned that we should not be choosing between business and health. And Oleg Dubyansky will speak now. So this is the CEO of GlaxoSmithKline in Russia. So, Mr. Dubinsky, what is your view on the pandemic? Thank you. Good afternoon, dear Mrs. Popova, dear Mrs. Winnie Byanyima, and dear Dr. Hans Kluge. I would like to thank the organizers of such a virtual symposium for giving me the chance to speak. Yes, we can hear you, but we cannot see you, unfortunately. Yes, please continue. Yes, sorry, the video, please. In the first place, I would like to so we would like to see your emotions and your face. Maybe you could use the video. Probably we have some technical issues. I would like to start with the words of gratitude and the words of support to healthcare workers who are at the forefront of fight against the COVID. And also, I would like to thank the healthcare workers who, despite limitations and difficulties related to new COVID pandemic, they are also continue to provide medical care to patients with different diseases, including HIV patients. And this is the topic of today's symposium. During pandemic, we see unprecedented mobilization of the civil community, pharmaceutical industry, and also healthcare industry. And we today heard lots of positive examples. And we can address that through partnership and cooperation between the key stakeholders and participants of those processes. Despite new challenges brought up by COVID-19, it is crucial not to waste all of our progresses in fight against other infectious diseases such as HIV/AIDS. And my colleagues pharmaceutical companies, they adhere and they are committed to provision of patients with the necessary drugs. We have about 20,000 employees, including Russia and all globally, and they continue to work at production facilities and in the labs, providing the continuity of all of the crucial process such as manufacturing supplies of drugs, R&D works, and clinical trials. Since the beginning of the spread of the new infection, GSK identified three key priorities in our work and operation. The first is health and safety of patients and employees, and provision of continuity of manufacturing and supplies of drugs. And the third is search of solutions to these problems of the threat of the spread of the infection. Talking about the role of business in fight against infectious disease, I would like to speak about two areas. So the first is the vaccine against COVID to prevent COVID infection, and ours as other companies in pharmaceutical industry, we support fight against pandemic. And since the beginning, we were considering different options, how to use our experience and expertise to fight against pandemic. And we are cooperating with several research companies and groups who work on vaccines candidates to fight against COVID infection and who are working on development of drugs. And we contribute our adjuvant innovative technologies. The use of adjuvant technology is especially important in pandemic times because adjuvant can decrease the number of vaccination protein required to produce one dosage of vaccine, which provides for higher volumes of vaccines and the higher numbers of people who are protected against it. Well, given the topic of our virtual symposium, I would like to speak about the work around research related to this infection. Accessibility of HIV drugs and provision of treatment of this is one of the priorities of our companies. Over the past years, in Russia, we managed to achieve certain progress in fight against HIV, but still the situation is alarming. A pandemic of COVID-19 had a certain influence on the medical care for people with HIV, is especially in the region with high spread of HIV. And in our country, we provide support and society to achieve the state goals of fight and prevention of spread of HIV/AIDS as innovation companies who are developing and manufacturing antiretroviral drugs together with our partner with healthcare. We have several key areas of work in this respect. The first is innovations in R&D investment. We are happy to hear you, but we said that we are not going to promote your company at today's event. So that was not planned. Please answer the question. Is your company ready to make the transfer of the technology for the well-being of the whole population? We are working on improving accessibility of drugs in many specialties, in many countries, in many areas, which includes Russia as well. We actively work with the regulators to increase accessibility of our drugs. We are talking about local manufacturing and about pricing policy. I mean that, are you ready to make the transfer free of charge so that it's used for the whole population? Are you ready for such cooperation with the regulators? Yes, we have such dialogues in different countries. There are certain criteria. Yes, we are ready to establish that. That's fine. What is happening? Thank you very much. We hear you, and I'm absolutely confident we'll come back to that conversation. Thank you very much, Oleg. Thank you. And we already heard all of the speakers which were planned in line with our today's agenda. Allow me to move on to the third part of our symposium, and we are ready to answer the questions related to our today's topic. And we have 3 co-moderators for this part of the symposium. Allow me to introduce them. Natalia Ladne, Senior Associate of Epidemiology, Scientific Institute of Russia. All of the projects in Russia and CIS countries are related to epidemiology. So they are led by her. She's organizer of all of our work in this area, and she's one of the key organizers in this work. Alexei Kravtsov, so this is our chief epidemiologist from the Center of Infectious Control, that's an NGO, and Yulia Godunova, head of YEVA Association, this is an NGO, and they improve the quality of life of women with HIV, viral hepatitis, and this is a non-commercial organization. And we are happy to welcome them as an NGO, as a non-commercial organization, and I know her personally. I hope that Julia, you will be active today. Dear moderators, I am giving the floor to you, so you are very welcome. Dear Anna, dear speakers, yes, we have lots of questions and we have such an interesting discussion today. And the first question is more philosophical, and I believe this is the question to Mrs. Winnie Byanyima. Will the epidemic of COVID-19 change the notion of right to health? How can this epidemic help us in terms of the right to the health, and how we can find that, to use that to fight against AIDS? So I think the translators are translating that.
Thank you very much for your question. This pandemic has brought to the fore the urgent need for all countries to ensure free universal health care, free at the point of use for all people everywhere. As the Secretary General of the UN has said, we are not going to we are not safe until everyone is safe. This pandemic has really emphasized our interdependence and also the need for guaranteeing the right to health for all people everywhere. But yet, it has also highlighted the huge inequalities which exist and which are in the way of guaranteeing this right to health. Because first of all, when this hit us, the whole world was hit. But in many countries, the capacity to fight back was not there. It was so weak. Take the countries, the low-income countries of this world, the low-income countries of Africa, of South Asia. These countries were already struggling to deliver on health. They had very weak public health systems. They were crumbling. They were highly indebted. Even middle-income countries, some had already entered a recession, a country like South Africa. So just the capacity to put out a response was so uneven around the world. There was a need to support some countries to fight back. And then in many countries, for example, in say 43 countries of Africa, because of the lack of investment in the health system, the health systems depend on user fees. People are required to put down some money in order to access health. Now, you don't need a lot of intelligence to understand that if to show up at a medical facility you must pay, this can't be the way to fight and end an epidemic. Unless you remove these user fees, you are fighting a losing battle. So we see that across the world, the way health systems are financed was very much in the way of fighting this epidemic. But it wasn't just a financing issue. It's also a rights issue. So many people who could come forward and be tested couldn't come forward to be tested because they are criminalized. There are people for whom their right to be full human beings is not recognized in many countries. So there was also the issue of having your human right to be able to enjoy whatever services a country may provide. So again, across many countries, you had sex workers, you had gay people, you have transgender people, you have many groups of people who have barriers, human rights barriers to access health. These have to be lifted to fight and win on an epidemic. Then coming to the measures themselves, even before I come there, I mentioned the huge inequalities in the way of access to treatments, to vaccines, to tests. Even before we got there, we had countries, poor countries, lining up to buy PPE, personal protection equipment, and couldn't access because the richer countries booked everything out. So you really had huge inequalities in fighting this epidemic, and we understood now that unless every country is supported, nobody is safe. So I mentioned the access to medicines, the access to a vaccine. We at UNAIDS have launched a huge coalition to try to fight, to make sure that for once now, the system of producing, of innovation, of producing and distributing is fair to everybody so that we all survive. And this is an ongoing struggle. So we see that the right to health, there are obstacles. One main one is the way health systems are financed across the world. We have told ourselves a lie that profit motive can deliver the right to health to everybody. I think now we see that that's a lie. The private sector can have a role, but the most important role is that of governments to ensure that everybody can have access to their right health. So financing health systems is something we have to think afresh about. Two, human rights barriers, removing them so that everybody is equal and able to access whatever the government puts before us. And thirdly, we have also learned that the drivers of health, that the social economic barriers have to be tackled for people to enjoy their full right to health. Where there were no social protection services, that is where we have had the worst and the least capacity to fight back. Where old people, where migrants, where poor people have nothing to fall back on, you cannot fight an epidemic. So again, the importance of social protection as part of delivering on the right to health has been highlighted. Those are some of my reflections on the question of the right to health and delivering it for all people.
Большое спасибо, Винни. Ну, действительно,
Thank you, Winnie. Yes, we can find lots of similarities between HIV and COVID, these two diseases, and we could remember those who work against the epidemic for many years. And the viral load test, we thought it was very difficult to get access to it in poor countries, and now it became a routine procedure. This is a routine test done in all of the countries. It is done to millions of people who are undergoing HIV treatment. Yes, we are optimistic with the regard to the example of HIV, and we are confident that we can fight against such a complicated epidemic, the new COVID-19 infection, and we will make the next steps to provide the right to health to many people. And now, dear colleagues, our next co-moderator will ask another question. Alexei Kravtsov, you have the floor. Sorry, the mic was off. Dear colleagues, hello. I would like to welcome and thank everyone for having such a symposium. And my next question will be to Dr. Hans Kluge from Maxim Sokolov, and he's asking, dear Dr. Hans Kluge, how do you assess the following? How our countries are fighting against the epidemic? I mean, I think he means the COVID epidemic. Pandemic. What are the strong and weak points of the Soviet healthcare system, and what is left out of it? He means the countries of Eastern Europe and Central Asia. I would like to hear your opinion about that.
Thank you so much, first and foremost, for this amazing symposium. I really enjoy it, and I really learn a lot. As to the situation of COVID, if I look from what I call the European region, the 53 member states, we have a kind of two situations. In the European Union, situation is stabilizing, but we see peaks. We have peaks in, for example, two regions in Spain, Catalonia, Aragon, in Germany, in France, localized, and then we have in a number of countries towards the east still quite an epicenter. In several countries, as Dr. Popova was telling, is also stabilizing, but a number of other countries, situation is still quite acute. The virus has not changed. I think this is the most important to realize, that the biggest threat is complacency, is to think whenever the situation improves that the virus has gone. Basically, nothing too much has changed. There is still no pharmaceutical intervention, no effective treatment, no effective vaccine. So the virus is still there. So what we are seeing is that the moment that the non-pharmaceutical interventions are being lifted, and wherever people do not adhere to the basics of public health, which means hand washing, cough hygiene, taking physical distancing, wearing the masks in environment which are crowded, that again there is a resurgence of the virus. So we will have to learn to live for quite a while with the virus. Now, if we go to the Eastern Europe, and many of you know that I had the privilege to work for more than 15 years in several of Eastern Europe, which is my geopolitical priority for my mandate, that there is a strong heritage, for example, CES system on public health, on the essential public health functions, on the surveillance. So many of the basics are there. In the Eastern Europe, there is the notion of universal health coverage, that everyone has the right to access healthcare without being pushed into the poverty. But of course, like all health systems, several countries have been caught by surprise. WHO, if we are honest, also in a sense has been caught at one moment by the speed and the devastation of the epidemic. So my main message would be a message of hope, that we see that if the governments and the people are implementing what we know is working, that we can push back the virus. And if I speak about hope, I would like to speak also about hepatitis, because we're speaking about HIV. We cannot speak about HIV without speaking about tuberculosis and without hepatitis. In the European region, 30 million people are still suffering from hepatitis, and today is World Hepatitis Day. So the key issue is that we have to have a holistic approach, whether it's COVID or HIV or hepatitis or tuberculosis in the prisons. We need to link with many sectors, and this is what Miss Winnie, Executive Director of UNAIDS, was telling, right? It's a multi-sectoral approach, and with the whole of society to come together. So I'm quite optimistic, but we need to explain to the young people now that it's not over. That's what I'm seeing. That in the beginning, the virus was attacking particularly the elderly people. Now we see it's in younger generations because it's summer. People are tired of the lockdown, and I can understand, and they have to work. So we don't have to blame the people, but we have to think what are the right message to the right target group. And here I'm learning a lot from all of you. I'm learning a lot from all organizations and countries which has been fighting HIV/AIDS through a societal approach, through NGOs, through civil society, and through youth ambassadors to convey the message. You young people have to be responsible now to the COVID, because otherwise, at one point, you will transmit it to the elderly people and mortality will start to increase. Thank you.
Уважаемый доктор Ханс Клюгер, благодарю вас за
Dear
ответ.
Dr. Hans Kluge, I thank you for the answer. And indeed, in our country, COVID pandemic is of quite adverse nature, and you're absolutely right by saying that people have relaxed and stopped taking precaution measures that were prescribed by WHO and our epidemiologists, and you need to set direction for people, but due to current circumstances, people sometimes are willing to use lockdown, and of course, Russian healthcare system supports them in this endeavor. I thank you for this answer, and now I would like to pass the floor to Yulia Vladimirovna. Colleagues, good day to you. Thank you very much for such a great number of questions that are forwarded to us, and I sincerely hope that we will be able to address as many as possible. We get lots of questions addressed to UNAIDS, and Rustam asks us the following question. You said that COVID and HIV pandemics, I think it has to do with the presentation of Winnie Byanyima, shed lights on the existing inequality. So what did you mean by that, and what does UNAIDS do in order to overcome inequality? Hello, Yulia. Unfortunately, Winnie Byanyima had to leave us. Therefore, I will be the one who will answer the question regarding inequality. Those who have familiarized themselves with the Global AIDS report that was issued in early July before the International AIDS Congress that was in online format for the first time already know that one of the core subjects for us is not only impact of COVID, impact on HIV epidemic, but also on inequality. And we talk a lot about HIV and other infectious diseases, and inequality does not only highlight differences between developed and developing countries, it highlights differences between different communities within one country. And we are talking about companies with mid incomes and above average incomes. In context of COVID pandemic, we see that people that are well-to-do or that have better connections or other means may get medical treatment without any queues. They can be tested ahead of others. And this is something what we could observe in terms of HIV epidemic. We know that medical treatment as well as testing facilities were not available to all groups of population, but to the selected ones. But thank God, over the past years, the situation has improved with HIV. Nevertheless, we still have a huge gap when it comes to providing equal access to antiretroviral therapy. Ms. Byanyima call is linked to the following. Many countries right now shifted their focus on COVID pandemic, and this is right, of course, but it should not exacerbate inequalities that exist nowadays, and it should not exacerbate the equal access to medical services. Dr. Kluge also said that it is also important when it comes to combating hepatitis and TB. We are talking about providing medical services. So when we talk about inequality, we should not solely focus on HIV or COVID or tuberculosis. We need to have a single coordinated approach in combating all the diseases. It is a strategic issue. And today, we are focusing on COVID because it is pressing. But hopefully in several months, the situation will stabilize and we will get back to other issues on our agenda, that is combating HIV, tuberculosis, hepatitis. Well, in any case, we need to exercise a coordinated approach, and that should be done not only on the part of the governments, but on the part of public organizations. We need to mobilize our communities so they will be engaged in a full-fledged manner. And this way, our response to coronavirus and other infections will be far more efficient. Thank you very much. Thank you very much for this detailed answer. And now I pass the floor to Natalia Ladnaya. We have quite many questions, but not so much time left, dear colleagues. Indeed, we have a curious question that should be of concern for all people. That is related to a possibility of launching a vaccine. I think this is a question to be addressed to Russian surveillance Agency. Anna Popova had to leave us, but here we have Anna's deputy. So the question sounds as follows: what are the chances of receiving the vaccine against COVID infection in the near future? What scientific data do we have available? And are we going to provide vaccines to HIV patients? And what is a realistic timeline in this regard? Thank you, Natalia Nikolaevna. On behalf of Olga Popov, I would like to say thank everyone, and she apologizes for leaving early due to her tight schedule. Indeed, developing a vaccine is one of the most important items in the global agenda as well as the local one. We are carrying out scientific research. We should say that in the Russian Federation, we are developing 24 versions of vaccines by using different technologies, and there is a vaccine that already has passed a stage of preclinical trials. We also and now there are vaccines that have been approved for first stages of clinical trials, and we are talking about, among others, vaccine that has been developed by Vector Scientific State-of-the-art facility. So, of course, Natalia, you are right by saying that here we need to thank WHO for providing this platform to exchange scientific data. Therefore, it is important to enrich knowledge of all the countries in this scientific area, and by doing so, all countries are informed in an updated manner about what's going on with the research at a global level. As for providing vaccination to patients with HIV and other infections, we know that this issue is being started, and I think at WHO's website there are 140 vaccines that are declared to be under development, and among them there are vaccines also to be given to patients with HIV. As for prospects for vaccination, as Hans Kluge said, here we need to hope on quick and timely emergence of vaccine which is safe and efficient. At the same time, we understand that this is a relatively new infection, and many regulations, including the one in the Russian Federation, do their best to prepare clinical trials in the speediest manner. And we need to assess not only the effect of vaccine per se, although we are sure that sooner or later developed vaccines will provide preventive effect. However, we need to take into consideration the production capacities at a sufficient level. It's not enough to develop a good vaccine. It is important to provide it to all people in need. It's important. And here, of course, no country will be able to do it on its own. We will need to provide support to developing countries. We will need to coordinate this endeavor in a centralized way. But again, no matter no matter how many hopes we pin on a vaccine, we cannot get relaxed. We need to continue working in the same way to prevent further spread of infection, and continue exercising all the measures that will help us contain the infection, and hopefully one day we'll be able to overcome this pandemic, and hopefully quite soon. Again, developing vaccine is a scientific intensive process, and the best scientific facilities worldwide are engaged in this process, and I'm sure sooner or later it will provide the desired results. However, before the vaccine is provided, we need continuing taking all the measures to protect our people. So let's adhere to the principles and do our best in that. Maybe Dr. Kluge has something to add. Yes, of course, it's very interesting to hear the opinion of Dr. Kluge because WHO is a leader in spreading scientific data when it comes to preventing infectious diseases. So what does WHO think in terms of prospects of emerging new vaccine? And of course, everyone is worried about the timeline. Of course, we understand that we can get isolated, we can continue wearing masks, but we would like to get back to our normal life as soon as possible. The floor is yours, Mr. Kluge.
Thank you very much. And I think that Dr. Smolensky gave a very comprehensive overview. Thank you, Dr. Smolensky. So very few to add, maybe 2 points. One is an important facility. It is called COVAX facility, which is supported by WHO and Gavi. And in fact, we encourage countries to participate at the COVAX facility because as the executive director of UNAIDS was cautioning, there are blocks, for example, the European Union, the United States, which have already signed deals with pharmaceutical companies to reserve the first 100 million doses, which means that for the other countries, this will be very difficult. The COVAX facility is globally, and countries have to commit, and I will encourage countries present here to also look into that. We can provide information so that when the time comes, there will be a equal access, equal distribution as much as possible of the vaccine. Meanwhile, the WHO Regional Office for Europe is working on what we call a allocation framework. So to prioritize which groups of the population to be vaccinated first, because even the richest countries most likely will not be able to vaccinate the whole population at once. So this is one point, the COVAX facility. The second point is not to underestimate the hesitancy by the people to be vaccinated. Because sometimes we think that the vaccine is going to solve everything. In certain countries, about 40% of the population is hesitant to be vaccinated. So, and we know this from other vaccines as well. Vaccines save lives. Again, we should not blame the people who don't want to be vaccinated, but try to get insights into their community. What is the issue? Are they concerned about certain aspects? And here again, we can learn a lot from the science by sociologists, anthropologists who have been working on the response on HIV/AIDS, that this is not just a medical issue, but try to understand and then target specific segments of the population to overcome their resistance. Having said that, I'm so happy really that I took the time to participate at this symposium, because why is it that we still don't have a vaccine against HIV/AIDS? This is the other very big pandemic. So in that sense, we have to continue to implement what we know is working, and countries like the Russian Federation, which are committed to global access, which are developing vaccines, are very, very important. That's also why I participated at the meeting of the Ministers of Health of the Shanghai Cooperation Organization last week. Many of those countries are doing clinical trials. So thank you again to also Rospotrebnadzor, to the Russian Federation, the Ministry of Health, for this very, very important scientific studies. Thank you.
Большое спасибо, доктор Клюге, за
Thank you
ответ.
very much, Dr. Kluge, for this answer. I understand neither WHO nor Russian surveillance agency can tell you definitely when vaccine will be presented. We heard news about and promises about HIV vaccines. Sometimes we even heard news about last stages of clinical trials. However, still we don't have vaccine against HIV, but we are able to combat that disease without vaccines. So we should exercise approaches that are most specific and best for these or other infections. We are wrapping up today's program. We heard lots of great presentations. It was very interesting for me to listen to the answers provided by speakers. Now I would like to give the floor to Vyacheslav Smolensky for closing remarks. He's the Deputy Director of Rospotrebnadzor. The floor is yours. Thank you, Natalia. I will be short. First of all, I would like to thank all of you for your interesting presentations. Thanks for finding time in these challenging times that are so energy consuming and demanding. So thanks for joining us today. We are sure that our joint efforts on the part of governments, world organizations will help us achieve great results when it comes to combating HIV and other infectious diseases. We need to take a closer look at strategies of overcoming pandemics, identify gaps and lacunas so that we can quickly eliminate them, and that will speed up the pace of reaching sustainable growth goals. I hope that our next meeting will take place in a face-to-face format. We know that there had been many questions provided for our speakers. On our part, we suggest the following. We will send the questions to secretariats, to WHO, UNAIDS, Russian surveillance agency, and the answers will be published online. I would like to thank everyone. I would like to thank interpreters, all our speakers, and our colleagues from the association. We are all together, and I'm so proud to have witnessed the efforts of our volunteers. I would like to thank our moderators, Julia, thank you. And I also would like to thank Natalia Ladne and her colleague. Thank you all very much. And again, I would like to thank interpreters and hope to see you soon. All the best.